Hi, this is Dr. Donald Pelto, and I'm going to go over this week's review of the current diabetic articles that we find on the internet. So this first one here is from April 14th. It's foot wounds are a big threat to diabetics. This is a study of people that had diabetes and they had foot wounds, and they're talking about some new research. And so what they said, they were trying to treat minor sores and to protect their feet. So people with diabetes often lose their feeling in their feet. That's called neuropathy that we've talked about before. This sensation can make them more prone to getting a foot injury, which we all know about. So this new analysis focused on 171 participants who reported having a foot ulcer of at least 18 months. And for a period of 18 months, each person was checked for new ulcers. During 1 week, sensors in their shoes reported how often participants wore their shoes and how many steps they took. During the study, 71 people developed ulcers on the soles of their feet, and 41 of them as a result of some type of a trauma or injury. So really what this shows us is that the patients who wore the customized shoes in their feet had a 57% lower risk of developing new ulcers. So this is something very important. If you have diabetes, it's important for you to have diabetic insoles and diabetic shoes. Now, I usually recommend waiting until after the ulcer is healed before you get into the diabetic shoes. But once the ulcer is healed, to help prevent problems, getting custom diabetic insoles and special diabetic shoes can be very helpful. Here's another video here about diabetic foot ulcers are deservingly feared. This is actually a question that was presented to Dr. Roach here. My father's an 84-year-old diabetic. He has a wound on his foot on the inner side for about 5 months. He's been treated by a podiatrist who debrides the wound every week. He prescribed antibiotic when it looked infected. A visiting nurse and my mother have been changing the dressings. This week, the podiatrist recommended he could see the bone or osteomyelitis and recommended hyperbaric treatment. Could you tell me your opinion? So the answer here, what this doctor talks about, who isn't a podiatrist, is actually an answer about hyperbaric ulcer treatment. And he says here basically that you want to prevent ulcers from developing, which is correct. And in extreme cases, you do use hyperbaric treatment. That's actually one of the only reasons and only ways to get osteomyelitis or bone infection. Usually what I say, if someone has a bone infection or osteomyelitis, it can either be removed surgically, removing the bone, or you can take 6 to 8 weeks of IV antibiotics, or you can certainly try hyperbaric oxygen treatment. Okay, this next article, stepping out for spring, people with diabetics should check their feet first. So this is something that was, I believe, sponsored by the American Podiatric Medical Association. So the importance that as people are getting out and doing more walking in the summertime, they should be checking their feet daily. And this is really of the utmost importance, not only checking your feet, but also looking inside of your shoes to make sure that there's nothing there. So the first thing is to get a green light from your healthcare provider to make sure that everything is okay. Be mindful of footwear, especially if something is too small or you don't know it's too small because of your neuropathy. Wear socks and well-fitting shoes. If you have diabetes, you should probably wear a diabetic shoe that can be provided for you. If you do notice a problem, it may be a foot ulcer. So usually ulcers start as blisters and then develop into a sore. It can be on the sides of your foot, on the bottom of your foot. It can be just seen as a blister. And if this blister isn't treated, it can get worse. Get your ulcers treated. Really, you don't want to wait. You want to get these treated as quick as possible. It's explaining there's one type of treatment here that can be used, but there are many different types of treatments. And then let it heal. Really stay off your foot until things get better.